Good morning. Today we're going to be talking about gut health because the 29th of May just passed was the World Digestive Health Day, and I think it's something we all need to know a lot more about. Because according to the old adage, which says, food, let food be thy medicine, the food has to pass through the gut, and the gut is a very, very important part of your health system. Thank you, Dr. Chinasa and Dr. Asaolu, for coming on the program. It's a pleasure to have you both with us.
Thank you for having
Thank
me.
you.
Yes, I think critically, we have a gastroenterologist talk about the technical aspects and a lifestyle medicine physician to help us talk about that aspect as well. So it's a pleasure to have this combination, really, when we're talking about our digestive health and our gut health. So if I can start with you, Dr. Ashaolu, can I ask you, what is it? I mean, like, what is the gut? Okay, maybe we'll see what our gut health. What is the gut? What is the gut health? And how does our digestive system change from infancy to old age?
Thank you so much, Dr. Pamela. It's an honor to always be on your show. Pardon my voice. So when we say gut, generally, we talk about the apparatus, which is a combination of different structures and organs that are responsible for digestion, absorption, and assimilation of whatever we take. It's just that these days we're having more information regarding the fact that the gut is literally not just for absorption or digestion. We have other associated issues associated with the gut that's related to the health of human beings. So generally we talk about maybe from the mouth to the anus, which is the tract. When you put food in your mouth, it goes through the esophagus, goes to your stomach, gets digested, gets absorbed in the small intestine. The large intestine helps us to absorb the water, absorb some nutrients, then will excrete the waste product. So the constellation or the interaction between food and the body towards excreting what we don't need and assimilating what we need is generally what we mean by gut health. And this actually changes as people grow and advance in ages. Usually from infancy, we talk about a lot of immature digestive system because the gut health is not necessarily dependent on these structures as if we're doing mathematics, 1 + 1 = 2. In the gut, 1 + 1 might not be 2 because there's some other factors that also contribute to whatever we need a gut to do. So we have some Spanish, some English into the gut to help us like eat and digest whatever we're eating. So we have digestive enzymes, we have microbiota, bacteria in the gut of individuals that also contribute to this digestion. And so when children are at the infancy stage, they have a lot of underdeveloped digestive system. And so you have a lot of problems sometimes with digestion. You have colics, you have them refluxing, the motility of the gut is not optimal. So food stays, they don't even know themselves. And sometimes it is what the parents are eating that actually affecting them. These children might end up having allergy. They might not know because they are still developing it. So yes, that's from infancy. When you get to the adulthood, the adolescent adulthood, we have stable digestion. We have, yes, everything is formed. The gut system can function on its own. The bacteria that we need because we've been exposed to different bacteria, we've eaten a lot of things. The gut bacteria themselves are also developed. However, at that stage, a lot of things depend on diseases, habits, diet. So sometimes an individual might be healthy, but because of maybe intake of some antibiotics, might end up having like excessive diarrhea or excessive allergy because of the diet. Sometimes somebody might take too much of sugary or fructose containing food, and because of that, the person might actually have diarrhea. Sometimes it might be because of what you eat. You eat a lot of bread, you're constipated. So a lot of diet, a lot of lifestyle. Sometimes when the people are stressed, they have a lot of irritable bowel syndrome, So this at that middle stage of life, it is more of your diet and your decisions, what you eat, what you do, your lifestyle that have determined what the gut seems like. And some people are smoking, some people are drinking, and sometimes this causes things like peptic ulcer disease. Some people are overusing NSAIDs maybe because they're tired. And so because of that, they have ulcers unnecessarily. And as people go older into adult old age, middle age, 65 and above, they have some deterioration. There's reduction in production of digestive enzymes. There's sluggish, the nerves that supply these vessels with this apparatus we've talked about, this pipe from the mouth to the anus that I said is responsible for digestion and assimilation. The nerve might be this damaged. They are receding, and also so they have very slow movement. If everybody is running, they are kind of walking. The gut is walking. The gut is tired. They have a lot of constipation. They have problems with digestion because their digestive enzymes are reduced. Some of them also have comorbidities. Some people are diabetic, some people have hypertension, some people are on medications. These are all things that we look at it, they affect the gut or the output of the gut health. So when I say that gut health is not 1 + 1 = 2, I'm talking about all these constellation or additional factors that determine what happens in the gut. Thank
Wow,
you.
there's so much. There's just so much to talk about, to think about. I'm sure a lot of people sit here and we're not thinking about all of these things. In fact, some people say that the gut even replaces the brain in terms of its importance in the body because of so many things that gut affects. In terms of the different things that the gut has an impact on. So before we go any further, I need you to explain a simple term that is everywhere. That is microbiome. Everywhere you turn, people are saying the microbiome this, the microbiome that. Can you just, in simple lay words, simple words, we all lay people out here. Can you explain what is this gut microbiome and what are the implications? Why do we all need to know about it?
Thank you very much, Dr. Pamela. So the microbiome, just like the words, is like organisms. They are microorganisms, they are bacteria that are living in the gut. Okay, just like every individual, we have some bacteria living on our skin. They are natural, that's their natural habitat. So we have bacteria. So not all bacteria, the fact that they will say bacteria or microbiome does not necessarily mean that it is causing problem. So you have germs. It's just that they are good germs. I'm trying to see how to make it like very simple. So we have like germs that are living in the stomach, but these are not all bad germs. We have some in the mouth, we have some in the stomach. And when we talk about microbiome, we talk about this environment that houses these microbes and also the microbes themselves. And usually I explain to patients by saying that they are in equilibrium. There's a democracy that is going on. Everybody's voice is heard in the gut. You have good bacteria, you have bad bacteria, you have structures that help to maintain that stability. That's the normal microbiome in such a way that people function. And yes, in recent time, we found out that these microbiomes are actually connected to a lot of other things in the body. Immune dysfunction, diabetes mellitus, that we believe that because when you have a healthy environment in your gut, it affects other things. Some people talk about asthma developing because of this abnormal microbiome. So any disruption is what causes the problem. And usually the disruption comes from either people overuse antibiotics and you're trying to cure a bacterial infection, you wipe off the good one and the bad one, or you wipe off the good one and leave. You wipe off a lot. Unfortunately, the bad ones are very, very strong. They are very, very virulent. So they grow more than what the good one, more than the rate at which the good ones are growing. And so you have tendencies to have infections from or problems because now you have excess of bad bacteria growing. So everybody respects themselves. Yes, you are opposition party, we are the ruling party, but everybody's control. But now imagine somebody now wiping off the opposition party so that or wiping off the good party, so the opposition party are now the one in charge. So that's what happens. So any disruption is what causes the problem. Usually it's whether either people are overusing antibiotics, people are smoking, people are eating too much, people are taking medications that they don't even know the side effects. They can cause an overriding of the normal microbiome.
Wow, there's just so much to talk about. I don't even know where we need to go to, but I think that explanation of what's the difference between good bacteria and bad bacteria, I think also helps a lot of people because people always wonder why are people saying don't take antibiotics, don't take antibiotics, taking too much antibiotics is bad. But if we know that taking antibiotics is wiping out our good gut, good bacteria, and the bad ones then take over and cause problems for us, and I'm sure a lot of people would take it easy on taking the antibiotics. So that has been very, very useful. Thank you very much. Dr. Chinasa, a lot has been said, but there's actually so much more I'd wanted to ask, but it's not possible. But let's just start with you. What are the lifestyle habits that most strongly influence our gut health across our lifespan?
Lifestyle factors that pretty much they actually shape the gut health. One time when we actually heard a lot about gut health was during the COVID time. Everybody was intentional. Everybody, oh, gut, gut, gut. And why were they so particular about it? Because there was a lot of information coming out about gut health and immunity. It's important to know that 70 to 80% of immune cells sit in the gut. So the health of the gut influences the overall health of the human. And just like Dr. Sola started saying about the lifestyle factors, especially at different stages of life, that can shape the way our gut responds. Dietary patterns, how are we eating? What are we eating? Exercise, are we moving? Stress levels, sleep hygiene, and even water. Are we drinking enough or not? Smoking and alcohol, these all influence the gut health, the health of the gut, literally at different stages of life. Now, let's look at diet. Someone was saying earlier about, they'll say, don't eat bread, don't eat this. Evidence has shown that reducing just as much as 10% of consumption of processed or ultra-processed foods improves your gut health by 10%. So reduce 20%, it improves your gut health by 20%. What are ultra-processed foods? These are foods that are different, very different from their parent form. Let's take, for example, something as simple as wheat. We know wheat that we use for swallow. When you make wheat for swallow, you go to the market, you buy your grains, you grind it and make it into swallow. Semo is also from wheat, but semo is a processed swallow. So when you're comparing the quality of what are you getting, we need to be eating more fiber-rich foods in their whole form to improve gut health. So you see that both are swallows that will go with any of our soups, but the quality is different because for the semo, the bran and all the good stuff have been removed. The fiber-rich components of the wheat have been removed to make it that soft, white, fluffy option. Now,
Okay, so please don't, before you move any further, I know you have a lot to say. For people who are listening, can you rank them in terms of, the which you mentioned, the maybe amala, the eba, the semo, and I can't think of any other one, but just to give people an idea of which are better than which, because some people say, "Oh, don't eat eba," and a lot of people go for the poundo yam. I'm not talking about pounded yam, the poundo.
yeah,
And so there's some things that a lot of people are eating a lot of stuff, and perhaps this is where we could clarify to them, this is better than this. So if they have an option, they choose the right one.
yes. So it is better. You see, the goal, when I always say, when you want to think about it, think about where did this food come from? So that means how far from the farm did it process before getting to your plate? That will tell you, or the one that you can't really imagine. So take, for example, something else like, okay, let's look at our fufu. There are some people that make fufu, which is what Igbos call apple, and I think Yorubas call it lafun or something. So, there are some people that make it without the chaff. In the process, the way it is made, a lot of the chaff is removed in the process. So it is very light and different. But when it is, even fufu is a very good probiotic food, which is so good for gut health because it goes through the fermentation process, and depending on how it is made, not those that now it's a different conversation when we start talking about, because there was time it was like people were using bleach to make it so that it gets so white. So no, putting all that aside, if we go back to the original way it is made, we see that it retains its fiber, and the fermentation is so good for the gut health because fermented foods are natural sources of this good bacteria that improves the gut health. That's the microbiome we talked about earlier. So on the original fufu, let me use the word original fufu is so good. Wheat is so good. Eba is so good, of course, without all the extra things people are doing now to make sure that the eba swells in a different way and not swell. Those are now human factors that are altering these things. So really, that is so good. Semo, really, I always say semo should not feature in the life cycle of swallow options. It is not an option. It should not even be an option. Maybe for chickens, yes. But for humans, it shouldn't really be a swallow option because a lot of the good stuff had been removed. So it's better to take
What about poundo?
So between
because people are eating poundo and
now
as opposed to pounded yam.
And pounded yam. What I tell people is you buy one tuber of yam, a good looking tuber of yam is around 5,000. Real good looking one. Now you go buy poundo yam 1 kg from the store and you're buying it for 950. Make it make sense. You see that how did it's a business. How did one tuber of yam processed will not even give you 2 cups? So that means most times it is fortified, which most times food regulation allows that. Yes, maybe it can be fortified with cornstarch or some other stuff, and you're having less of the yam inside. The more you process the food, the less fiber goes out. So pounded yam, pounded yam is better. Yes. Ordered fufu and orderless fufu. Ordered fufu is better. The fufu that has smell is better than orderless fufu. Yeah. So did you want to say something?
I don't think there's any poundo yam that is 950 again, though. Maybe that was there.
No, maybe
but still,
yes,
it doesn't matter.
But really,
it's just the comparison.
5,000.
It doesn't weigh. It doesn't weigh up.
Yeah,
it doesn't weigh up.
I get what you're saying, Dr. Chinasa.
Yes.
Yeah.
So
it's very important.
It's business, so it's important to know that it's still business, but the goal is for you. Is it favoring you or is it favoring food industry? You have to think about it.
There's a lot to talk about, but I also personally have some questions, and I'm so happy you talked about our own fermented food. Because when you go abroad, they say, oh, eat fermented food, oh, yogurt, oh, kimchi, oh, this, oh, that. Meanwhile, we have our own very good fermented foods. And one of the big ones I want us to talk about is pap. Because we have pap, but pap is no longer, in fact, I had to specifically ask for someone to make the strong tasting one. Now it is so bland. They're not fermenting it the way it used to. Can you tell us a bit about how good or how not good pap is for us now?
Oh, pap is both probiotic. It has, when it's done well in the original form, it's so rich in probiotic and so rich in fiber. Now, let me put this clause there. The way we make our paps now, over time, we don't want the smell and we do not want we want better consistency. Because of that, we're sieving the pap a lot. I always say there's the one they call Ogi Baba. That's the one with the shaft in place. So they didn't sieve that shaft out. That is so good for restoring gut health. Aside from that, I'm trying to remember the name it's called. The water that sits on the pap is also a rich source. Is it omikun or I've forgotten what it's called? There's a Yoruba name for it. It's so good, rich in probiotic. if you have gastric issues, you're feeling unsettled, you just drink it, you feel the calmness is almost instantaneous. And you wonder that how, why are people not taking this thing? I think it's
Yes.
so much westernization and
Yes.
the urge for what's the name? To feel among, like let it be more presentable. If you make the Ogi Baba, it's not presentable, it's not picture friendly because there's so much spots. But we want something that looks good, and we're going for custard. People are not making
Mm.
pap anymore. And we're
Wow.
like, that is the food of the ancestors. And the ancestors got that bit right. From childhood through adulthood, it's so good. Amala is so good because of its fiber content. It's as an original amala. Let me keep putting
We have to
original
be
there.
quality. Yeah, we have to
Yes,
put
it
it the
has to be.
caveat.
Yes, original, because when it's made from the scratch, when we're in boarding school, they make it with both the back of the yam and the yam itself. So we're literally eating everything, and nobody bothered that it was so dark, extra dark than the darkness. But sometimes we complain, but over time I'm like, that was the good stuff. You're getting the whole entity of the plant. So those are things that help to improve the gut microbiome. Look at our Iru is another very good fermented food. Iru, the locust bean.
Yes.
Ogiri. Igbos will call it ogiri. Hausas call it dawa dawa. So rich, but no, we don't want the food to smell. The food we smell somehow. We're so bothered about superficial. Oh,
Aesthetics.
yes,
Yeah.
I don't want the smell. When I put Iru in if I sit and cook, nobody can enter my house. Open the window. If they don't want to come, they are not welcome to the banquet.
It's just,
What?
actually, this has been a very stimulating conversation. You won't believe our
Yeah,
time is up. I can't even
yeah,
believe it myself. We actually
yeah.
have to now go on to last words for our listeners, but I can tell you this much. We will be coming back to the two of you for more discussion on this. We have to, because I think we've only just, touched the tip of the iceberg, and the gut is so important, as you said, for our immune health and our overall health. We have to come back here. So please, can I have our last words for our listeners? Dr. Asaolu, if I can take you first.
Thank you so much. Um, Generally, the gut is dependent on what we do. So yes, the gut is ready to work for anyone. It's been there for everybody, but a lot of what we see these days is because of what we do. We are making decisions for our gut, and these decisions, as we've been saying, include our diet, include those things, social habits, alcohol, sleeping, exercise, water intake, and so we need to know that. And unfortunately, as we make these decisions, they also end up affecting us and making decisions for us. So you're first making decisions for your gut, then your gut will make decisions for you. Because if you have health challenges, you end up running around trying to see what to be sorted out. Also, the role of fiber in our diet cannot be overemphasized. Dr. Chinasa mentioned something, and I want to reiterate it, that we'll talk about fiber. Fiber is important, especially for people that have constipation. Part of what we tell them is that they should not sieve their pap. You should drink it like that. So we have a lot in our environment. Let's go back to the farm. Let's go back to appreciating and celebrating what we have so that our diet can also reflect what who we have. Because in those days, Nigerians don't have colorectal cancers. Africans don't
Exactly.
have it, but these days we have
Exactly.
increase in the incidences and prevalence. So let's go
Thank
back.
you.
Let's go back to the drawing table and make differences.
Thank
Thank you
you
very
very much.
much.
It's actually something I've always said. I did not, as a medical student, see colorectal cancer, at least colon cancer. I've seen rectal. Colon cancer was just not something we saw. Now it's everywhere. Dr. Chinasa, please, your last words.
So I'm just going to quickly say you have to be intentional with what you eat. If you're not sure how to eat, just always remember G-bombs. That's an acronym for greens, beans, onions family, mushrooms, B for any form of whether strawberry, local berry, one berry we used to eat in just also, and seeds, flax seeds, sunflower seeds, sesame seeds. Incorporate that in your food and be intentional with moving. Exercise, very important. Stress and sleep improves your gut health. And of course, there are no safe levels when it comes to colorectal cancer or oral cancer and alcohol. So receive wisdom.
Yes, thank you very much. Thank you. We really appreciate the two of you on the program. Thank you for watching. Please like, share, and subscribe for new video updates.